Hello and welcome as we continue our discussion with Dr. Michael Kerner, Director of Education at the Association for Advanced Training in the Behavioral Sciences. We're talking about the examination for the professional practice of psychology. And this topic is one I think everyone will find interesting, and where Mike is certainly an expert with over 25 years of teaching experience for the EPPP, and that is how to review a mock exam item. Mike, can you talk to the viewers a little bit about how should they approach and look at and review and read, etc., a mock exam item?
Okay. Well, a few comments about looking at the exam items. It is very relevant to read very carefully what is the question asking. So often on this exam, a question might start in a direction that our colleague thinks it's going to go, but that very last sentence may shift really what they're looking for. So the very first thing you always want to be answering to yourself is, what are they asking? I like certainly going down, reading those options down below. Ideally, if you can eliminate a couple of choices and come back and only focus on two choices, well, that's ideal. Colleagues will say sometimes that's hard to do. So what I was hoping to talk about here is to talk a little bit about how someone can improve their ability to take these test items. So maybe I'll start with a story. And the story is when I, back in the mid-1980s, was purchasing AATBS materials. It came in a box. I opened the box. And the first booklet I picked up said, IO, Industrial Organizational Psychology. And so pithy was my background in IO that I said, who knew? I didn't know that IO was industrial organizational, meaning I had a lot of work to do. So that certainly raised my anxiety, but perhaps my motivation. And I ended up doing something that, in hindsight, was more clever than I realized at the time. I had a colleague who I still think of fondly, who is a clinician now in Berkeley, California. And he was studying for the exam, and he was an IO guy. And I went to him, and we sort of did an exchange of services, so to speak. I had some areas that I felt I was strong in. He had IO. And what we started to do is to read questions aloud to each other, read the answers aloud to each other, and then give all of our thinking out loud. Later, I learned formally that's called protocol analysis, and I think that that is a very good thing to do. I think it's a very good thing to do with colleagues who are studying for the first time after they've been a little more depthful with the material, not initially. A lot of times we don't want to hear that initial thinking. Absolutely, I think it's important with colleagues who are retaking the test, because if you can sit and listen to a colleague who's preparing and you listen to a set of questions, sometimes what I hear is a specific set of what they're doing that may be effective or ineffective in getting the answer to the correct answer. Sometimes people will get there and then they'll kind of keep on going and overdo it. Other times they are doing a process that actually shows up with some continuity, and whatever that process is, you try to hear enough questions in protocol analysis that you can go, oh, there, you did it again. And so I find it's a helpful process. I thought I would do one here, and hopefully that can be helpful to folks who are trying to organize this large task, studying for the EPPP. And so if you would benefit from this, I think probably either writing down what I say or hanging on really closely to a test question that I'll present orally. I'll say it twice, and I will say the answer parts twice as well. I'm going to start with a question from the world of ethics, since that's the largest of our A areas, and hopefully this can be of some use. So the test question I'm going to present to you is: a 72-year-old man is referred to you. However, you do not have background working with this age group. The question before you is regarding potential institutionalization. Again, an ethics question is presented to you in the exam format, and it says, you are referred a 72-year-old. You have not worked with this age group before. The question before you is regarding potential institutionalization. Here go 4 choices that, of course, have to be there. A, you can take this client with consultation. B, you can take this client with supervision. C, no, you must refer this client. D, refer this client to a geropsych specialist. One more time. A, you can take this client with consultation. B, you can take this client with supervision. C, no, you must refer this client. D, refer this client to a geropsych specialist. In role, I would be thinking out loud, and here's the protocol analysis. I'm on the exam, I've read that question, I've looked at the answer set, and obviously it's an ethics question, but it's a compound question. There are really 2 different questions that are embedded. So what I would encourage is separating it out and only answering the first question separate, meaning you are referred a 72-year-old, you haven't worked with this age group before. Now, in my thinking on this exam, I realized that I am supposed to take this exam from the perspective of being a licensed psychologist. So what do I do if I am referred someone in an age group that I don't have that requisite background to have familiarity with that age group? Is there a way I can take this person on for a first time? And I'm thinking there has to be a way where I can take a first 72-year-old on, or am I locked in my clinical practice throughout my career of never being able to take a senior on because I haven't had access? There must be a way. Then I come down to, is that an issue of consultation or is it an issue of supervision? And I would tell you that this is an issue of consultation. Typically, issues of supervision will be issues of sophisticated tests and or techniques. This would be an issue of consultation. Let me go to the second half of this very same question. The question before me is regarding potential institutionalization. Okay, now there is a hierarchy of whose needs come first when thinking about ethics questions. That hierarchy should be the patient is first. I like to call it the 4 Ps. Patient first, then the public, then the profession of psychology, and we, the psychologists, we make the 4th level of whose needs come first. So when you have competing needs in ethics, you should be guided on this exam by the 4 Ps, meaning, again, that the patient's needs will dominate. So as I look at the issue of institutionalization, whether I want to build my private practice, that's irrelevant. That's in the 4th position. The first position is this patient. If I don't have experience with this group and the issue is such a significant potential life-altering decision regarding institutionalization, I'm thinking a referral is going to be necessary for the second half of the question. Now there's 2 choices. One says you must refer. The other choice says refer to a geropsych specialist or someone who specializes in seniors. Well, let me go to the answer first, and that would be for the second half, D, refer to a geropsych specialist. I want to come back and I want to talk about that option C, you must refer. And before I do, let me say this, that now you have 2 incompatible responses. On the first half of the question, I would have taken the person except with consultation, except the back half of the question said, too significant an issue, my training is not sufficient for that. The patient would be best served referring this person to a geropsych specialist, someone who really has significant training and experience working with this population. Therefore, I would pick D as the answer on this test question, and I want to come back and talk a little bit about C. No, you must refer. You should be very careful in reading any ethics question or any of the answers on this exam that use an absolute, a word like must, always, never, all. When you read that word on this exam, you should take that as a semantically driven exact statement. All means in every single situation. So when you see an absolute, what I'm going to tell you, it will very likely shape your answer in one direction or another. That's one example of protocol analysis and trying to kind of debrief one question.